Good morning. So I'm here at my client's house. He's on a break right quick. So I wanted to make this video as kind of a prelude to the one that you're going to see following, where I have him attached to the um, Tesla Duo, which is a PEMF device that he's rented from Dr. Pollock's website. I have my DC microcurrent running on his triceps, and then I've ultrasounded mechanical heat his forearm flexors, and following the video, I actually did the distal end of the biceps and the and brachialis to continue to loosen the flexion, the tightness. So he is a stroke survivor, and what you notice in stroke survivors, the way they present, is that the affected side, the arm, is always locked in elbow flexion. And that's because the biceps and the fascia and everything tightens down. That's a feedback that is not getting or not coming from the cerebral cortex, where the affected areas of the brain have been impacted. And so the goal here is to orthopedically release the tissue so it can be functionally trained while still doing transcranial magnetic field stimulation on the brain to improve the motor cortex functioning and blood flow and delivery of nutrients, so a person can then benefit for gaining limb use per the research in that respect. And then obviously he's walking, so we're working on releasing fascial restrictions that are binding muscles from range of motion to achieving hip extension. Obviously internal external rotation of the femur, adduction and abduction of the thigh when ambulating, so that the body, he doesn't fall, or he's not taking too wide of a step unnecessarily, or as he fatigues, he doesn't become physically complacent, which can line up the injury model. So in the next video, where you see me and him talking about what I'm doing, why I'm doing it, this has been my approach to helping someone in neurologic rehab. And it turns out that other researchers in other countries have also found that using magnetic field therapy with some type of peripheral nervous system stimulation is functional. It works. It's not something, it was once said to me that these are too many signals. The body can't recognize what it needs to do when it needs to do it. And guess what? It's measurable. It's not, it is possible. It can be done within certain considerations. I mean, I'm not, if with electrical stimulation, if you can run 24 channels on a person, then that should be able to tell you that you can run multiple signals of the same type on someone. So magnetic field therapy is converted to DC from the AC wall outlet. It's converted to DC inside the unit and pushed into the body as a magnetic wave. And my electrical stimulation and my microcurrent units are also DC. So yeah, there's some fine tuning between each one, in terms of a type of wave or what actual frequency it's at, but nonetheless, it's functional. So stay tuned. Well, what we did was I used the ultrasound on the flexors of the hand, so to loosen them, because your bicep inserts down here on, right? So with the bicep inserting down here, I needed to loosen and calm down heat and warm this area to increase nutrient flow. I've always worked on the bicep, so now that muscle in there is just pliable. Like it's biceps femoris and brachialis are both malleable, really good. So that makes them soft to extend the arm. So now we have tricep stimulation going to help extend the elbow. And the PMF is hitting the brachial plexus, which is the nerve bundle that coming off the brain down the neck, runs, and it booms like a spaghetti junction highway network right here that all run to the arm. So you got you have the brachial nerve, the median nerve, the ulnar nerve, the radial nerve. You have all of them, and their roots off the spinal cord, they bunch up here and then branch out. So that's why we want this stimulation to excite them to function. So I have to get rid of the orthopedic restrictions of the tight muscles, the spastic tone, to reduce that so that we can create function and capitalize on the fact that your triceps are already innervated. So there's no reason why we shouldn't be using them to capitalize on their use, as well as your shoulder.
So if I use the flex tone, just run that on active. No.
You can run it on active or on strengthening.
That's right, there's a strengthening.
So active is active recovery, and then strengthening is, let's see, this is running antagonistically. So your tibialis anterior is contracting, which is lifting your toes, dorsiflexing the ankle, and then it cuts off and your calf contracts. So you're rocking your foot up like this, with the E-stem, and that's you can feel your toes lift on the, so, you can feel that.